The study we'll be presenting is the incorporation of a novel FLT3 inhibitor, Gilteritinib, into standard chemotherapy for newly diagnosed acute myeloid leukemia patients. The idea here is that the FLT3 is a receptor tyrosene kinase that confers resistance to chemotherapy, and the hope would be that adding this new medicine to the standard treatments would improve the outcomes of patients with that condition. Sure. Our update this year will be presenting results of 66 patients who've been treated on the phase 1 study so far. What we've been able to establish is the recommended phase 2 dose, maximum tolerated dose of Gilteritinib when given in combination with standard chemotherapy. We've also will be reporting the results of the FLT3 mutant group of patients who've had a greater than 90% complete remission rate with this combination. We believe that the ability to take these medicines together are reasonable, and the adverse events are very typical of what we see with acute leukemia induction. Acute leukemia induction involves treatments that often put you at risk for infection. So a lot of the adverse events that we saw as part of the study are typical febrile neutropenia and pneumonia type complications. Specific side effects related to Gilteritinib include nausea, diarrhea, but they're typically low grade and not hard to treat with standard treatments. The plan would be to move forward with a phase 2 and phase 3 study. We will be comparing this combination with Gilteritinib to the same backbone chemotherapy with the standard drug midostaurin. Those will be done separately in an American study and a European study. And Gilteritinib has been approved the past week for relapsed refractory acute leukemia. As I mentioned, the dose we'll be using in the chemotherapy newly diagnosed treated patients is the same dose that's approved for a relapsed refractory setting.